I'm joined remotely via Zoom by Megan Freebeck, the CEO of Simply the Basics. Thanks for being here, Megan.
Thanks for having me.
So I would love it if you could please provide the audience just a quick overview of why you created Simply the Basics and the Hygiene Bank. And what I also found really interesting was your whole idea of the marketplace.
Yeah, absolutely. So I think the idea of Simply the Basics was a long time coming. Before moving to San Francisco about 8 years ago, I was managing a homeless program, an interim housing program in Chicago, and moved to San Francisco and was working at San Francisco Suicide Prevention at the time, and really realized on our crisis line how so many of the people calling in were in distress because they just really couldn't meet their most basic human needs. So at first I thought I would do a one-time support to the community. This was back in 2015. So menstrual care was not yet the popular donation drive it is today, which is phenomenal that people really have stepped up and understood this need. But we set a goal to collect some menstrual products for anyone in need, anyone experiencing homelessness. And in 2 days, we had gathered enough supplies for every single person who might statistically menstruate and was experiencing homelessness in San Francisco, which was in the thousands. So we knew right away that we were onto something people wanted to support and that there was a need for. But I have worked in nonprofit for a really long time. I know how often people get an idea and they run with it. So I said, we're not going to do that. We're going to really make sure we understand what's going on and what the need is. So we did about 6 months of research and surveying, speaking to people experiencing homelessness. We surveyed over 100 nonprofits, and we worked with the San Francisco General Hospital to understand why were people going to the emergency room. And what we found was that second to accidents and to a substance abuse or mental health distress, it was infections. If someone was experiencing homelessness, they were very likely to get an infection because they couldn't stay clean and they were sleeping outside and a cup might get dirty or they might have a skin disorder. So we said, okay, we will respond to that need of sanitation. So that's what led to creation of the Hygiene Bank. We set a goal to improve health and wellness through hygiene and save nonprofits time and resources, because we really found that nonprofits were spending on average 14 hours a week just getting really poor quality supplies. But I work professionally with Project Homeless Connect, and it was there that I could see the type of stuff people donate. It's opened products, it's used things that don't really help. So we really knew that we would set out to provide quality things, recurring supplies, items that really impact physical health. And, in that way, we kind of are focused on Maslow's hierarchy of needs. If you can't meet your very basic need, you're not going to achieve any other goals. So that's where Simply the Basics came from. And today it is an expansive hygiene bank. We work a lot like a food bank, but focused on hygiene care. And to your question about the nonprofit marketplace, that's for all these items that are not necessarily hygiene, but it works like a Craigslist, and it's totally free for nonprofits, and anyone can donate on it. The rule is you're not selling like on Craigslist, it's just putting items up for donation. Because like I mentioned, nonprofits get so much stuff they don't actually need, but they aren't allowed to throw it away. So that's why we created the nonprofit marketplace as well.
And so how has COVID-19 impacted the distribution, if you will, of hygiene products through the bank? I imagine it's somewhat virtual, but you still have to move products around. And so how is that going? And I can imagine that the demand for products has really expanded given that so many people are unhoused still.
It's huge. We have known for the 4 or 5 years we've been doing this that hygiene health is public health. Access to sanitation and hygiene supplies, it's not only a basic human need, but it can impact the health of a whole community. And I believe the pandemic has really magnified that. It's really shown people what we already knew, which is that when someone in your community is sick because they can't clean, they can't wash their hands, they can't access showers, then everyone is at risk of getting sick. So we have seen greater awareness of the importance of what we do, but absolutely an increased request for supplies, increased request for very specific supplies like sanitizers, masks, face shields, thermometers, gloves, and cleaning supplies for facilities. I have never received so many requests for these ever before. And the challenge, the flip side is our volunteer groups are limited because we can't have volunteer groups in person and we can't have them walking around as easily, but we are certainly doing it in a very modified, safe format.
And so what would you say are some of the needs that, that you've seen and your team has seen that people can help with? Because to your point earlier, what people donate. So is it better to donate funds? If people have hygiene product, is there a place they can go perhaps on your site to kind of is a checklist of these are the kinds of items that we need if you want to donate them? And then of course, if people want to volunteer, which is very difficult these days, how can they go about doing that as well?
Yeah, so absolutely donating makes a huge, huge difference. You can go to our website, www.simplyvbasics.org, and there's a lot of information about hosting a hygiene drive, as well as making a monetary donation. And because of safety, touching supplies and moving supplies around, we do really prefer and appreciate when people make a monetary donation. It allows us to purchase and send directly to our recipients and to our partners exactly what they need. At a lot of sites, they don't want sanitizer that has a certain level of alcohol in it, things like that. So we can really make sure that exact needs are getting there. But we also have a really cool platform for remote volunteering. So a company, we had a group from Google have about 40 volunteers all join virtually. We get them the supplies in the mail, or they do a pickup of supplies. And then we have a virtual conversation about hygiene and homelessness. We do a little bit of a compassion training, and then we all pack the kits together over video. And we just ask that they be able to then drop them off at one of our receiving sites in their area. And we've got them all throughout the Bay Area. We've got about 80 different receiving sites that they could drop them off at. So families have done this, parents of kids have done this, individuals are doing this. Absolutely, we love to get volunteerism. And if you are looking to donate, you can sponsor a volunteer group too and help cover the cost of those supplies.
So Megan, in the process of doing this and creating the system and reaching out, could you, share with the audience perhaps one of your kind of favorite moments of getting the Hygiene Bank kind of created and its impact on our unhoused community members?
Yeah, we have done community events, and we're a volunteer-based organization, so we really have relied on the community. But we've done community events for 3 years. One in particular is my favorite. It's called the Women's Empowerment Day. It's for anyone who identifies as a woman experiencing homelessness or survivors of domestic abuse to really come and feel like the best version of themselves. And it's a really, really great, phenomenal moment that we host every year. We aren't able to host that right now because of COVID, but we have had a lot of, really impactful highlights during COVID. For example, there's one recipient. We refer to all of our clients as recipients. They're receiving support from us. And we were connected to them through their caseworker. And the caseworker shared with us that this person had developed a skin disorder from sleeping outside and being in the sun all day. And it was creating lasting consequences on their health, but also their dignity. They didn't feel comfortable. They didn't want to talk to anyone. They didn't want to be seen by anyone because it was visible. And they had so much shame that they stopped going to their appointments with their case manager. And so the case manager reached out to us and said, what can you do? We get bars of soap, but they don't lather, they don't sanitize, they're not dealing with infection the way it should. So through our Hygiene Bank program, where we really believe in getting people exactly what they need, we were able to collect them with a special dermatological lotion and ongoing wipes and washing care, because as I'm sure you know, even the few public showers that did exist are not operating right now during COVID. So we got them some wipes, some body wipes that they could use and washing care. And they were able to use these enough that their skin cleared up. And a few weeks later, we heard back from their case manager who said the recipient returned to their meetings and has since gotten into a housing program. They're no longer sleeping outside. So that was really great because it was proof that when hygiene needs are consistently met and met in a way that provides exactly what someone needs at that time, it can really be life-changing.
Thank you. That was great. I love the vision of that event, and when it comes back, I think it'll be even more powerful, with regards to providing all those wonderful wraparound services. Final question, through everything that, you've been through with your work in Project Homeless Connect and Simply the Basics, what are some of the good things that you could see coming out of the other side of our pandemic health crisis that would really help people with all of their hygiene needs, let alone all of the housing stuff that people are still struggling with?
That's such a great question. It's so hard to, think of any of this as having a silver lining, but I do believe that people are realizing at a much greater scale how important hygiene health really is, and everyone's hygiene health. We take it for granted when we can brush our teeth anytime we want and need to, and that if we get a cut, we can use antiseptic and put a Band-Aid on it and not worry about it or think about it again. We take that for granted, but when you don't have those things, it's all consuming. It's all you might be thinking about, and it affects your relationships, it affects your self-worth, and it affects your health. And now we see with COVID, it affects everyone's health. You cannot wash your hands if you don't have a mask and regular masks access all the time, then you might get sick and you might get other people sick. So I really believe that, what we're doing has never just been about one act of kindness. It's not one product, but it's a public health crisis that we're responding to thoughtfully, carefully, and we can't do it alone.
And so if people wanted to help, what's the best place to go to?
Definitely our website, www.simplythebasics.org, and you'll find contact forms and helpful information. And if whatever you're looking for is not on there, just go to the contact page. You'll see an email. You can reach out over email and someone will respond very quickly.
And do you have any COVID-19 style funding campaign that you guys are working on at the moment?
We wrapped up a big PPE campaign to get masks and sanitizers and gloves and thermometers. We went through that very, very quickly. So mid-November, that we hope to just keep seeing us through this pandemic, which is going to be really focused on raising the funds that it takes to add a new partner organization. So we're going to really focus on help us raise the funds we need to add these partners that are serving our community.
Great. Thank you, Megan, for sharing your work on Simply Basics. Of course, all your wonderful work with Project Homeless Connect. We'll make sure, as always, that your contact information, social media, website are shared out for viewers and listeners of this interview. And again, please stay safe as we continue to work our way through whatever this dystopian future is we have before us.
Thank you. I appreciate it. You as well.